live a healthier life. And this morning we're going to be hearing from one woman and her journey with fibroids, the diagnosis, how she was able to adjust her lifestyle, and in terms of medication treatment, and also exercise to be able to deal with this disease. So I'll let you go ahead and introduce yourself. I know you brought your nurse to give us more of the technical aspects of this, so I'll have you introduce yourself first.
Well, my name is Fatma Mohammed, and just like you mentioned, I unfortunately, just like many women, had to suffer in silence because I was diagnosed with uterine fibroids, and this was several years ago. So almost 10 years ago, and unfortunately for me, throughout the years, the fibroids just went on increasing in size and in number, and in the end I just had to have them removed, which is a surgery that I had to undergo. So throughout the process, it's a lot that I had to learn, unfortunately the hard way. So I'm just here to make sure that I share that information for women to make changes.
We appreciate you very much for being able to share your story. We'll meet your trainer a little bit later on to talk about the workout or the fitness aspect of it. But I'll have you introduce yourself as well.
Yeah, Mwanakame Athman, a nurse. I'm here just to talk about the reproductive health and answer any questions that deal with fibroids and hormonal imbalance.
Okay.
Yeah.
So you mentioned that she mentioned that she had uterine fibroids.
Yeah, yeah.
Let's define fibroids first, more generally, for anyone watching who might not be aware what the condition is about, and then you can talk a little bit about the different types, such as uterine.
Fibroids are they are abnormal growths that grow in the uterus. So there are different types of fibroids. There are the intramural, where they grow in the muscles. There are others that grow at the cervix. There are others that grow within the wall of the uterus. So it depends with the location and everything. That's where you'll find different treatments. For the symptoms, we have this abdominal pain. The fibroid may be pressing on the bladder, so you'll be frequent urination or the urinary infections and everything like that. Then you can also have constipation because the fibroid might be pressing on the GAT tract. Then you'll be having back aches, menstrual disorder. You may be getting a menstrual period after, like, let's say 2 weeks or 2 days, and a heavy flow. Those are the symptoms of fibroids. Your belly might also swell and look like you're pregnant, and it's because of the fibroids.
And how common are these amongst women, amongst Kenyan women particularly?
Among Kenyan women, 90% get fibroids or cyst. So you are supposed to go for
90%.
Yeah. It's either you suffer from a cyst or a fibroid, or these other benign tumors of the uterus. So you're supposed to go for regular checkups for you to check. Yeah.
When you say regular checkups, how regular are we talking?
For a woman of reproductive age, you're supposed to go for, after every 6 months, you're supposed to go check your estrogen levels. It depends with the hormonal pills you're taking, for the birth control pills, which hormonal method are you using. If you're using the birth control pills, after every 6 months, you're supposed to go check your estrogen levels. If you're using these other things, you make sure that whatever you're using is not affecting you. Then for for cervical cancer, you have to go for yearly pap smears, so that you cannot get cervical cancer without you knowing, and early diagnosis is the best.
Yeah. So again, these are things that are detectable as long as you're going for regular
checkups.
For regular checkups.
Yeah.
So I'll come back to you and hear a little bit more about your story. Of course, this is Daybreak, and if you have any questions or comments, go ahead and use the hashtag Daybreak. You can tweet at Citizen TV Kenya. So you said several years ago is when you were diagnosed. Tell us about your diagnosis and whether you had any idea what uterine fibroids even were at that time.
Yeah, well, I had no idea, absolutely no idea. I remember I just felt something like a pebble in my belly. So I just pressed my belly around the navel area, and I felt something really hard, and I couldn't really tell what it was. And since at that time I lived a really healthy and fit lifestyle, I couldn't really come up with anything. So I just gathered courage and I had to go to a hospital. And that's when I went to see my OBGYN, because when he advised that I have to have an ultrasound, I wanted to know, like, why are we doing the ultrasound? And he said, let's just check so that we can see what could be there. And then right after the ultrasound is when I discovered that I had a fibroid. At that time, it was one fibroid, and it was the size of a pea. So he just diagnosed that I had a pea-sized fibroid. And so at that time, since I did not have any of the symptoms that Mwanakame mentioned, it was just something I felt in my belly. He just felt like it would be advisable that we do something called watchful waiting, whereby we just wait and see if you develop any symptoms, then we can act on it.
So no medication at that point?
None at that time. And so since I'm still in my reproductive years, unfortunately at that time, it just meant that it just gave room for the fibroids to grow and to multiply. So in the end, you know, by the time I went for my next ultrasound, I had 5 fibroids and they were quite large.
Wow.
Yeah.
That must have been devastating for you to hear that.
It was quite hard because, you know, I followed everything the doctor said, and I really wanted to ensure that I did everything as, you know, as he advised. So when I followed everything, I just went on with my life. I was still eating, you know, I ate right. I was quite healthy. I exercised a lot. But I remember I just felt like my tummy was just extending. The abdomen was quite extended. And since, you know, I was just fit, but then the abdomen was quite extended, I remember, you know, like I had people who just said me, maybe you should just go back for another ultrasound just to see. And when I went back and discovered that they had increased in number and in size, that's when I knew I have to now take action. Yeah.
Right. So, you know, she's telling us her story, and I'm sure people might be thinking or watching at home and thinking, what causes this? And for it to be at such a high percentage of women that experience either, like you said, fibroids or cysts, what are the causes?
The exact cause is not known, but we'll say it is inhibited by, you get fibroids because of heredity. Maybe your mother or your sisters or anyone in the family had fibroids. You can also get fibroids due to high estrogen levels, since high estrogen levels makes the growth of the fibroid grow bigger.
Okay, so again, that comes back to types of birth control, or
That's you should check estrogen levels because of that, since estrogen makes the fibroid grow larger and larger. So if you're using birth control pills, you're supposed to go and check estrogen levels regularly. Other causes is obesity, lack of exercise, and things like that.
Which wasn't the case.
For her, it was hereditary. She once told me that her mother had fibroids and her relatives. So for heredity, it's the main cause of fibroids.
Yeah. Okay, so you go back, you have 5 fibroids now, you're saying, and they've increased in size. So what does the doctor advise you to do at that point?
You know, at that point now, he just told me we have to have the surgery. So he had given me options, so which I'm sure Mwanakame will get into, but he did tell me that I had the option of having a myomectomy, which is when they have to you have to have an invasive surgery. So this is a major surgery to have them removed because of the location and the size and everything. I couldn't really do what we call a laparoscopy, and a laparoscopy is a non-invasive surgery, but then it would suit someone whose fibroids were not large. So in my case, I was advised to have the myomectomy. And before I could even get to have the myomectomy, during that process of just going back and forth with the doctor and confirming everything, unfortunately, I ended up having a blood clot in the leg, DVT. So, and this happened because, as he informed me, it's simply because of the size of the fibroids and where they were located. So they disrupted the circulation of blood, the lower part of my body. So the moment I discovered that I had DVT is when I realized, you know, I knew it was serious, but I realized this is now quite serious. Because now that meant we had to now wait first before we do anything about the myomectomy. We have to take care of the issue of the blood clot.
That's life-threatening.
So it's something that I feel like most people really think about fibroids as, yes, it's an issue, but then most women suffer in silence. But the one thing is that you might not know that you could end up, unfortunately, getting another condition or suffering from another condition as a result of fibroids. So it's really important that the moment you discover you have any kind of condition that is related to reproductive health or your reproductive system, to act on it immediately, and at the same time to make sure that you have the right doctor that gives you proper advice for you to take care of the issue.
Right. What effects do fibroids have on fertility? You know, with such a high rate of people, or percentage of people that you've talked about having one of these types of conditions, what then happens, hopefully, you know, in a case of a successful treatment, either surgery or whatever else, how does it affect fertility?
It depends with which treatment they took. There is one, they can do the surgery, where there is the laparoscopic surgery where they do not cut, they just use tubes just to get the fibroids. Then there is the hysterectomy, where they have to remove the whole uterus. In case it has spread through the whole uterus, you have to remove the whole uterus. For that, when you remove the whole uterus, you cannot give birth. Your fertility goes to 0.
Wow.
Yeah.
I mean, that's That's incredible and shocking, and hopefully more people will be able to, like you're saying, not suffer in silence.
Exactly, because I do feel like, you know, when you are given an option, because in my case I was given options, but then at the beginning most doctors just told me we just have to do the hysterectomy, we have to remove the whole uterus. But personally I did not want to go with the option, and I'm sure that they had their reasons, but deep down I believe there has to be somebody who can actually do this for me and ensure that they do not affect anything related to my fertility. And so that's why it took me a while before I had my surgery, because I was looking for the proper doctor. And I remember everyone used to just give me advice, and I mean, it's good, people just give you support and they give you advice, and I felt like, you know, at the end of the day I want to make sure that I get the fibroids removed, but then at the same time I can be able to have children. So I mean, it varies. Different women go for different options. Some women are at a certain age where they don't feel like they need to have children, and they might opt for the hysterectomy. And there are some women who feel like they do, and they'll opt for the myomectomy. And also there has been a lot of growth in the country in terms of some of the treatment options. And you know, like, there are not many women who are aware of some of the options. So it's very important to actually get the information, because when you have information, the moment you walk into your OBGYN's office, you know the questions to ask him or her.
You're well informed, and
and so someone cannot just give you an option and tell you, no, you know, you cannot do this, because I can count more than 10 doctors who told me, no, you won't be able to have children, you won't be able to do this.
You saw but that many doctors?
I did, and it was not just in the country. I did a lot, and I went to so many doctors. I mean, even around the country, I went to Malindi, I went everywhere. And because, you know, anyone will just tell you, I had so-and-so is a good doctor, just go to him, just go to her. And when you get there, you do the ultrasound, they do the checkup, and then they tell you, unfortunately, I don't think you're going to be able to, you know. So I was so used to hearing that, but I knew there's going to be someone one day who will tell me I can sort that. So the moment I got that person, I just felt like I need to get it done. I need to get it done. And
had you dealt with your blood clot issue at this point?
Yeah, at that time he just told me what we have to do. Let's just deal with the blood clot, and then we do the surgery. So in my case, I was in the hospital for around 7 days because of the blood clot. So this is when they just you have to be on blood thinners constantly every single day. And then when I went back home, I had 3 weeks of no movement, nothing. And so you just, you know, you keep your leg elevated, and you have to now keep on taking the blood thinners every single day. Unfortunately, they're quite expensive. So within 2 weeks, you spend close to around 7,000 bob. And you'll have to be on them for quite a while. I was on them for several months, since November all the way to, I think, March, April.
Wow.
So every single day, you have to make sure that you take the proper dosage. And, you know, and then when the doctor just gave me the go-ahead and said, now we're good, then we went in and did the surgery.
Wow.
Yeah.
And what was the recovery period like? What was it like after the surgery?
Wow, that was difficult for me, because I'm a very active person. And all throughout, I remember I was trying to find out what are some of the things I can do to help the situation, because my first few days I was in a lot of pain. And because of the pain, I just felt like I couldn't do much. And because I cannot do much, I felt like I was immobile, basically. But all throughout, I really thank God, because I followed exactly what the doctor told me. Just told me take rest. And, you know, just the first month is the most important for recovery. So he made sure that he put me on, you know, a good dosage of iron tablets and syrups, a lot of medication for pain, which I really needed. I was back on the blood thinners again, because surgery in itself can be a reason for you to get a blood clot. So you definitely have to be on the thinners. And then right after that, I remember I was just I was just resting a lot, but eating right and just thinking positive, staying positive. And the most I could do for myself was just do some light yoga at that time. I just did light yoga, and I remember it helped me a lot with the blood clot in the leg. Helped me in a huge way. And then now when I felt like, now I think I feel okay now, when I asked my doctor if I can start training and working out, moving my body, he was like, yeah, let's do it, because also being inactive can be a reason you get a blood clot. So you have to make sure that you're constantly talking to your doctor just to ensure that you don't get
consulting.
Yeah.
We're going to get to your trainer in just a moment, but I just want to end on a note of women who might be watching who have a history, genetic history of fibroids in their family, or who are concerned that this might be something that they're struggling with. What is your advice to women watching today?
My advice to reproductive women is make sure we go for checkups. Anything you feel in the body that is not right, whether you feel like your belly is too large than normal, whether you feel that you have a certain pain of the abdomen, irrespective of what you feel that is not right, you should go to hospital. The cervical cancer screening of the pap smear is very important. Checking your estrogen levels, make sure you are taking the right family planning method B is also good. You're also supposed to maintain hygiene. Hygiene is very important in women. You're supposed to maintain hygiene at the highest level, because also infections, you know, our reproductive system is not like the males. We are very prone to infections, so you're supposed to maintain hygiene to the latter. Yeah, and anything that you make sure you seek information about fibroids, about reproductive health. We usually have pages, me and Fatma, that we talk about more. She talks about more of yoga, fibroids. I talk about more of reproductive health. I post videos of reproductive health. I ask people what they want to hear. If it's about contraceptives, talk about contraceptives and all that.
That's very helpful. Where can people get those pages or that information?
Yeah, for my Instagram, Facebook, and Twitter, it's The Kenyan Nurse.
Yeah, and mine is at Fatma Sparkle. So Fatma Sparkle on Facebook and on Instagram as well.
Okay.
Yeah.